I just wanted to first thank Sean and TB Care for the opportunity to speak and just to be here and to learn together with you all. It's just been an incredible couple days of learning together. My name is Michael Wilson, and I work for an NGO that's called Advanced Access and Delivery. We're based in the United States, and we're really focused on addressing double standards of care in the access and delivery of essential medicines and healthcare to historically marginalized groups. Most of our efforts to date have been focused around the global TB epidemic, the opioid crisis in the United States, and more recently around the needs of displaced groups and refugees, mostly in northern Iraq. We're a group of clinicians, public health advocates, epidemiologists, public policy experts that are really focused on working together with partners to improve both the quality of programs, but then I think as something that was mentioned earlier today that's very important, on really extending the reach of services into the communities, the neighborhoods, the spaces where people live, where they work, and where they congregate. In the United States, in 2017, there were 72,306 people that died of a drug overdose. That's more than 1,300 people per week. And just to put that into perspective, that's 3 Boeing 747 jet engine crashes each week. Close to 60% of those were caused by opioids, and as Steve mentioned yesterday morning in his talk, probably over half of those now are from synthetic opioids. In the United States, opioid overdose deaths are now the leading cause of accidental deaths. As you can see from this map, the rate of deaths from opioids continue to rise and become even more widespread, as in 2016, 26 states reported a statistically significant increase in deaths over the last year. The first time that I visited an OST program was in 2012 in Durham, North Carolina, which is a city that's about half the size of Durban, where I'm based now. I was currently enrolled in a master's program in public health with a focus on health behavior. And during my first year of study, as a lot of programs, you are just thrown into the theories. And so we learned about a lot of the underpinning theories that have to do with predicting acceptance of an intervention, the likelihood of people or communities to complete a treatment program or to maintain some sort of behavior or that's related to their health or well-being. And some of these are such as the social cognitive theory or the trans-theoretical model or the health belief model that you see on the left. And as you can see, there are many factors that are considered, such as how somebody might perceive their risk, their moods, their level of social support, the environment that surrounds them. But just from a glance, I just want to know what you all first notice about these frameworks that attempt to predict a behavior or a decision that somebody might make about their health or what they feel like is best for them. The first thing that I notice that comes to mind is that there's a lot of boxes here. There's a lot of steps, and there's a lot of flow in one direction. And not to be cliche, but I think we all know that people and communities don't fit into a box. I would say that during that time in my program, I got really good at drawing boxes and frameworks and arrows, and I hope none of my professors end up watching this. But while I think these theories and frameworks can be very important, as we all know, to consider in developing or evaluating programs, I think as has been mentioned already today, there's a whole range of other factors that need to be considered and that we need to be open to, I think, as we create our own definitions of a project or a program performance. So shortly after this immersion into these theories, I joined a team of students and of professionals that partnered with an organization called the North Carolina Harm Reduction Coalition. This was at a time in the U.S. where there were many bills that were being introduced in response to the increase of opioid overdose deaths around the access of naloxone, around Good Samaritan laws that provided some level of amnesty to those who called for medical assistance on behalf of someone who was in an overdose situation. Also around access of clean syringes. And as these new policies, as you can see here, these are just a few that were passed in the southeast, most of the southeast United States in a short period of time. So as these new policies were passed around the region, and programs were really responding in an urgent fashion, there was a group of us that was asked to spend some dedicated time with the individuals, with the communities that would be influenced by these policies and by the subsequent programs to distribute clean needles, that would lead trainings and dispense naloxone, and that would engage the community about their rights related to calling on behalf of somebody in an overdose situation. And what we learned from these conversations with members of law enforcement, with people that are using drugs and their friends and their family, with librarians, with first responders, is that there's really a unique set of factors that contribute to a program being practical, to activities and the design being acceptable, and to the delivery methods of a certain intervention being scalable. And so skipping ahead to this past May when I met Monique, she asked me if I would be interested in taking some portraits of the men and women in the Durban OST program. I told her that I'm not really a photographer, but I did bring a camera with me to South Africa, so sure, I'd have a go. So she began to tell me about the truly stunning transformation that many of them had undergone, and asked me if I could help to capture this as part of their journey. And as I began to come to the center, I was greeted every single week by the same friendly, warm faces and warm individuals that some of them are here today. And these are men and women that I would soon get to know, get to hear some of their stories. And what I initially observed from sitting in a room like this was that this structure was very similar to other peer support groups that I had been a part of in the United States, in Haiti, and some other places that I've had the opportunity of working. There was a space for open and honest dialogue. There was zero tolerance for judgment. There was amazing staff support and services, such as the psychosocial support that Monique just referred to. There was a shared desire amongst the group to listen and to learn from one another, and there was really a shared culture of respect between the participants and the staff that interacted on a daily basis. When I started to spend some more time at the center and getting to know some of the men and women, observing their interactions with one another and with the staff, and actually getting behind the camera, I realized that this community was really unique in ways that I hadn't seen before. What I observed over the last few months is that this isn't just a support group or a therapy program to these men and women. This is truly a platform that allows them the ability to find their own personal life normalization, what that is, and allows them to be the fathers, the mothers, the brothers, sisters, the leaders, the students, the entrepreneurs that they've always dreamed about being. And over the last couple of months, some of these key themes emerged that I wanted to just share with you. There's really a passion to learn and to share with others. There is a sense of deep respect and transparency and camaraderie amongst the participants. There is an eagerness to see each other be their best. There's a spirit of sharing, whether that's water from the fountain, a cigarette, food, money. There's a desire to volunteer and to make their community into a better place. And there's a sincere interest in each other and in each other's goals. So what I've maybe been struck by the most in these men and women is that they're not waiting. They're not waiting for Marilyn Monroe, but they're not waiting for the program to end, for a job to open up, or for their family to reach out to them. They're using the community that they've built with one another, the knowledge that they've acquired, and the confidence that has been built as a real launching pad to achieve truly honorable and significant life goals. And I'd just like to share with you a few of the photos and some of the short quotes that I believe will really capture the essence of this community and the transformative effect that it's had on the lives of all of those that are involved. Others have believed in me, and now I have been given the opportunity to give back to myself. The program has given me a second chance in life. I wish this for other people. It's helped me to see my mistakes and have the ability to progress in life. I now have the knowledge I never had before. It has helped me to take control of my mind. That's from Lungengo in Montclair. Wonderboy says, I want to get back to my taxi business, what I loved as a boy but lost because of drugs. Space says, my journey is to carry on helping others. When I came to the center, I was a zombie, but now I'm right. My family is proud of me. Now I am back home and everything is good. Ashwin from Chatsworth says, we are exposed daily to the devil, but we are fighting a winning battle. We are all winners, even though we may use drugs. In the past, my family has sent me to rehab, and it hasn't worked. Now they see hope that I want to change. I'm finally able to come back to where my life started. And so I just wanted to share some results that Monique might talk about a little bit more, but the results have been really stunning. I believe that the global average after 12 months for OST programs in high-income countries is around 50%, and the global average for low-income and middle-income countries is around 56%. There's over 76% retention rate in this program in Durban after 12 months. This is really on par with some of the internationally recognized programs in the Ukraine and in places in the US like Indiana or Georgia. There's been a desire to reconnect with families amongst almost all of the participants. Many of them have gained employment and go to work on a daily basis. Several have re-engaged in school and university, and others have dreams and hopes and are working towards that. Many of them are involved in community service, and also many of them are involved weekly in the psychosocial groups. And so what I hope I've convinced is that the real success lies beyond the numbers. I believe that this is a group that has far surpassed what many people may have thought was possible. And I hope that we can continue the dialogue about how we can learn from this and other labs of excellence and consider what might be what might be the most unexplored places of learning and launching. So thank you.